Good morning, everyone. Welcome to the holiday week edition of the RCAHD briefing. As usual, you have entered the meeting with your microphone on mute and video, but if you want to put a question in the chat, we will process it, or you can unmute yourself. So with that, Dr. Morrow, are you ready to take it over?
I am, thank you.
I'll start the recording.
Okay, so I'll start with our situation update as usual. Unfortunately, as we're hearing across the country, our case count went up again. Unfortunately, it seems like it took a relatively big increase over the last week. So we are up 582 cases in the last week. We had been down in the lower 400s a couple of weeks ago. So that's, it's really disappointing that we're going in the wrong direction. And I'm sure it's discouraging for a lot of people. So in terms of our total case count, we currently stand at 36,545 total cases of COVID-19 identified in our communities. 23,852 in the Alleghany Health Districts, 12,693 in the Roanoke City Health District. We continue to see about 20% of the cases identified in children under the age of 18, and about 45% of the cases in people under the age of 35. So we continue to see our younger populations disproportionately impacted by COVID-19, and we expect that that's related to lower vaccination rates in these populations. The good news is that now we have a vaccine available for our children who are 5 to 11 years old. The majority of our new cases, our hospitalizations, and our deaths continue to be in people who are unvaccinated. With respect to our hospitalizations, we currently have 32 people in the hospital. Of those, 21 are new admissions, 14 from the Roanoke City Health District of the total 32, and 18 from the Alleghany Health District. And unfortunately, we continue to lose members of our community to COVID-19. At this point, we have lost 669 of our community members to this just devastating disease. So that concludes the situation update. In summary, as people have moved indoors, as there were social gatherings, we have seen an increase in COVID-19 in our communities. Looking at the trajectory, we expect that this is going to continue to go up, looking at what's happening in other parts of the country and other parts of the world. For these reasons, I really implore people to be smart, be safe over the Thanksgiving holidays. Just be careful. The virus is still out there. It is still out there with a vengeance, and we need to do what we can to control it. With respect to our vaccination efforts, the good news is that now the vaccine, as I mentioned earlier, is available to children above the age of 5. Recently, the vaccine recommendations were expanded for booster shots for everybody above the age of 18 is eligible for a booster shot if they want to get a booster shot to add that extra level of protection. So with that, we've actually seen nice uptake at our CVC, our Community Vaccination Center at Sears. I had a community member approach me last week, and he said, it's such a great secret. So I asked him whether I could share his name. Ray Sandifer said to me, "You've got to get out there and tell people about the CVC. It was the most remarkable experience." And so he wanted me to impress upon our community what an amazing experience he had at the CVC, and he implores everybody to get vaccinated. So that said, the CVC has administered over 10,000 doses of vaccine to our community, and it's a great resource, and I strongly encourage anyone who is interested in getting vaccinated to check out the CVC at the Sears Center. So overall, with all of our vaccinators, we've now administered over 344,000 doses of vaccine. That's first, second, third, and booster shots to our residents. So with that, I will take any questions.
Hey, Dr. Morrow. It's Annie from Channel 10. I hope you're having a nice week. I have one or two questions for you.
Sure.
And I'm sorry if I missed it at the beginning, but we were just wondering if there were any updates with the people here in the district who were dealing with some of the issues from the hepatitis A outbreak. Just wanted to see if there were any updates, maybe if they were getting better or kind of staying the same, or if cases had kind of continued to stall out in terms of that.
Yeah, so we really have not seen any changes since the last report. We have a total of 51 cases that includes secondary cases, 31 hospitalizations and 3 fatalities associated with the hepatitis A outbreak. We are now outside of the second incubation period, and so we do expect that for all practical purposes, this outbreak is complete. So that's really good news. Unfortunately, it did have a profound impact on our community as well. And we continue to encourage people to get Hep A vaccine and to wash their hands, of course. So thankfully, we have not had any new primary cases associated with the initial outbreak, nor would we expect to, given that we're now 2 incubation periods outside of that exposure period that we saw in August.
Awesome. That's great news. A quick follow-up to that.
Mhm.
You guys see an increased interest in maybe people getting the Hep A vaccine after you had been offering that? So, like, did you see any increase in numbers after that and people wanting to get the vaccine for that?
Sure. I can only speak to the vaccines that we provided through the health department. Unlike the COVID vaccines, which are reported on a public website, we don't have direct access to the vaccine records of people who are vaccinated outside of the health system. I mean, outside of the public health system. So if we just look at the vaccines that we've administered, we administered vaccine initially at the restaurants to encourage employees to get vaccinated. And then we've continued to offer vaccines in our routine immunization clinics, hepatitis A vaccines. And so we've had a nice uptake. Just last week, we continued to have some people showing up for their first dose. It is a 2-dose series. So we encourage everybody who is interested in getting a Hep A vaccine to get a Hep A vaccine, and they can certainly come to our clinics.
Thank you so much.
You're welcome. I see a couple of questions in the chat. Should people looking to get a booster seek out the same brand as their original shot? Is there a benefit in getting a different brand? At this point, the recommendations really are to get whichever brand you feel most comfortable with. There isn't a specific recommendation one way or the other. People can definitely switch off. And I would recommend that anyone who has questions talk to their doctor, their healthcare provider about what their questions are. There are a lot of different types of questions. So I would recommend that be a one-on-one discussion. I think, so I got the same brand that I got the first 2. My daughter got a different one, and it really is convenience, preference, but there's no official recommendation. Just get your booster shot. This is another question. How's the turnout been at the vaccine center? Are you seeing many people who are getting their first doses, or is it mostly people getting boosters? Overwhelmingly, it has been people getting boosters the last couple of weeks. And certainly we've seen pickup in our 5 to 11-year-old population. So that's been really heartening. If we look at all of our jurisdictions combined, about 13% of our 5 to 11-year-olds have been vaccinated. Of course, I'd like to see that even higher as we go into the holiday season. But that's, I've heard of some jurisdictions where it's much lower. So I'm pleased that at least 13% of our children are in the youngest age group, 5 to 11, are vaccinated. We are still, though, giving first doses. And so when you see the numbers later, you'll see that there is a very slow but steady uptick in first doses. And so we really encourage everybody, if it's your first dose, your second dose, your third dose if you're immunocompromised, or if you're above the age of 18, your booster shot, come on to the CVC. Everybody's telling me it's a great experience, and please get vaccinated. Our numbers are not looking favorable, and we really encourage everybody to get vaccinated, to do what they can to protect themselves and their loved ones. As we head into Thanksgiving, we should be thankful that we have this tool, and we should use it to the best of our ability. Anyone who's out there who still has questions, please feel free to call us. We will talk with you in a non-judgmental way about what your concerns are and try to address any concerns that you have. It's important to us to make sure that you have the best information available to you to make this healthcare decision. Okay, question about there's a question about governor-elect, and I'm going to defer any questions about future policy decisions to the central office. I think we need to wait and see what happens. I'm certainly hopeful that we'll continue to be able to have all the tools in our toolbox to be able to combat this pandemic. Are reservations still, great question, Jean. Are reservations still recommended at this point to get the booster at the CVC? And no, Chrissy answered that in the chat, but just for anyone else out there, anybody can walk in. And on any given day, when I look at our numbers, because I do check to see how our CVC is going, I would say that there are a lot of days where we have more walk-ins than we do appointments. An appointment guarantees you a vaccine, but at this point, we certainly welcome everybody to come in, whether they have an appointment or are a walk-in. Just whatever we need to do to help you get your vaccine, we want to make it as convenient as possible. So we are accepting walk-ins, and we have plenty of capacity at the CVC. So I have heard from some colleagues in other states and in other parts of this state that it can sometimes be a little bit challenging to get a particular vaccine. Thankfully, we have no issues in our jurisdictions. The CVC has plenty of capacity for all ages and all vaccines. Are there any other questions? Feel free to speak up as well. You don't have to put it in the chat.
Dr. Morrow, this is Dave Seidel of Radio IQ. I have kind of a hypothetical question regarding, holiday events. So I'm just kind of curious what the advice is in terms of how quickly I should notify people and what I should be worried about. So let's say somebody goes to a Thanksgiving event and on Friday kind of starts to feel sick. What should the process be in terms of getting tested? When would you want to notify people who may have been at the event, maybe that you were exposed to or you exposed them? What would your advice be?
Well, so I think that the first thing is hopefully that person is vaccinated. People who are not vaccinated, who are planning to attend Thanksgiving festivities, should really get tested before they go, whether they're symptomatic or not. Certainly, if they're symptomatic, they shouldn't go. End of story. If you're sick, stay home. Don't get anyone else sick. If you're not vaccinated and you're going to be around a lot of people, and by definition, we're going to be eating at Thanksgiving, so likely masks are off. If you're unvaccinated, get tested before you go. Because you don't want to expose other people to this potentially deadly virus. If after the fact, regardless of your vaccination status, you have symptoms, you should get tested. And if you're tested, so you should get, if you become symptomatic, you should get tested right away. And if you test positive, I would strongly recommend that you tell everybody at that gathering that you have COVID so that they can get tested themselves and hopefully, get identified early if they were exposed and become positive. So I hope, Dave, did that answer your question?
Yes, thanks.
You're welcome. So to put it in a nutshell, if you're sick, stay home. If you're unvaccinated, get tested before you go. If you become sick after a holiday event, get tested as soon as possible and notify people if you're positive. Tom has a question in the chat. Do we have any understanding of why the numbers are going up again? Does it concern you that we're heading into the holidays where people will gather more? Absolutely, it concerns me. I was really hopeful when we started seeing that decline in our numbers. I was really hopeful that we would be going into the holidays with much lower numbers. The fact that we're going into the holidays with higher numbers is discouraging for everyone. Certainly it's discouraging for me. So why do we think this is happening? I think that there are a lot of reasons, but probably one of the biggest reasons is that we've gone inside. And so there are a lot more people inside. A lot of people are choosing not to wear their masks. And when we're inside and we have close contacts, we spread the virus. So I think that that's probably the biggest reason, is just that transition and more closer activity to each other. Are there any other questions? Again, feel free to speak up. You don't have to put it in the chat.
Hi, Dr. Morrow. It's Leanna with WDBJ7. How are you?
I'm okay, thanks.
Good. Thank you for taking the time to chat with us. We had a couple of questions from people who are watching on the digital news desk. I know we've gone over some of these before, but hopefully if some folks have some questions, we can get those answered. Again, I know that we've talked about this one before, but could you reiterate the question about taking a COVID shot at the same time potentially as a flu shot?
Sure, absolutely. And I'm glad that you brought up the flu, because unfortunately what we're also seeing is, while we have low flu activity in our community, in our state, we are definitely seeing influenza, particularly influenza A, starting to show up. So we strongly recommend, if you haven't gotten your flu shot, go ahead and get your flu shot. And you can get your flu shot and your COVID shot at the same time. There's no contraindication. There's no reason not to get them. So if it's more convenient for you to get them at the same time, go ahead. Your arms might be a little bit sore, but you'll be better protected.
Thank you, Dr. Morrow. A question from Holly. How long should you wait after you have had COVID to get a booster?
So that's a great question. There isn't a specific answer. We know that the natural immunity is pretty protective for about 90 days. So I would definitely not wait any longer than 90 days. But if I had COVID-19 infection and I was eligible for my booster, I would wait at least 2 weeks. Certainly you need to wait the 10 days until you're out of isolation. We don't want anyone going to get a COVID shot when they're still in isolation. I would wait a few weeks and then go ahead and get my booster shot. But the minimum amount of time is 10 days. And I would strongly recommend not waiting more than a month or two at the most. We know that our natural immunity starts waning pretty quickly after COVID infection, unfortunately. And I think that that's one of the reasons that we're just, this virus is persistent. It is really staying, it is really staying in a high circulating state, high transmission state. And I think that people's reliance on natural immunity is a false reassurance. It is protective for a minimum of 90 days, but the natural immunity wanes more quickly and is less rigorous and less predictable than the vaccine immunity. So I strongly recommend anybody who's had COVID infection to get their series wherever they are in this series. And again, another anecdote, my son had COVID last year before vaccine was available, and he got vaccinated as soon as he was eligible.
One thing I also have heard a couple of times, I took a call from a viewer recently, and a friend of mine who was scheduling their mammogram said that they have been asked to wait to get their mammogram after a COVID shot because it tends to swell lymph nodes a little bit. Was just wondering if you could address that.
Yeah, so that's a really good point. I had someone just ask me this a few days ago. They said, my mammogram is scheduled, but I really want to get my booster shot. So and the person's mammogram was scheduled a few weeks from now. And she knew that she shouldn't get her mammogram within 6 weeks of having her COVID vaccine. And so she asked me, she said, what would you do? And I said, I would personally get the booster shot now. We're seeing way too much disease activity right now. Get your booster now and reschedule your mammogram for 6 weeks later. as long as there's no risk, as long as this is not someone who's having a diagnostic mammogram, I have to be very, very careful. If it's a routine, low risk screening mammogram, at this point, I would prioritize my COVID shot because COVID activity is happening right now. But because of what we call the lymphadenopathy, the swollen lymph nodes, it is preferable to wait at least 6 weeks after your COVID vaccine before getting your mammogram.
Thanks for clearing that up. If you've got time, we got a couple other questions from folks in our chat, just wanting to, get some of their questions out of the way. We've got a question from Donna who wanted to know, specifically, we've talked about potential allergies for folks as they're considering the vaccine. If she wants to know if you have food allergies or if you are gluten intolerant, can you still get a COVID shot?
Yes, yes. So the only person that we would really be worried about in terms of getting a COVID vaccine who has a history of allergies is someone who's had a history of anaphylaxis, so that really severe allergic reaction to an injection, or someone who has a known history of allergies to any of the components of the vaccine. But food allergies are not a contraindication to getting your COVID vaccine. Seasonal allergies, there's not a contraindication. In other words, there's no reason to be concerned if you have food allergies. This is probably a little bit too much information, but I happen to have celiac disease, which is that real gluten allergy. And no problem at all. There's no relationship between food allergies or gluten sensitivity and the COVID vaccine. There's no concern there. And if someone does have a concern, it's easy for me to say that, but if you do have any worries, I would say definitely talk with your healthcare provider and make sure that you have all the reassurances that you need. But from the science perspective, from the evidence perspective, if you have any type of food allergy, if you have any type of seasonal allergy, you are still good to go and get your COVID shot.
Awesome. Thanks, Dr. Morrow. And I know we kind of talked a little bit about what you guys are sort of forecasting, but my last question for you, just again, to reiterate, kind of looking at the week after, the 2 weeks after Thanksgiving, can you just reiterate again what you're anticipating in that time frame and how you all will be positioned to react to what you anticipate?
Yes. Unfortunately, if we look at the trajectory, if we look at where our case counts were nicely dropping and now they're going up, certainly faster than I would like. I would prefer for them to keep going down. We expect this because of the indoor gatherings, because of Thanksgiving. We expect our case counts to now continue to go up for at least a few weeks. And as broken as this record is, I think one of the most important things for us to always remember is we have control here. We can choose to engage in behaviors that can change that trajectory, that can decrease that trajectory. If you're not vaccinated, get tested before you gather with anyone. If you are vaccinated and you get symptoms, get tested. Most importantly, the things that we've been talking about for 20 months, wash your hands, keep your physical distancing, try to do activities outdoor if at all possible, and most importantly, get vaccinated.
Thank you for your time, Dr. Morrow.
Absolutely. Thanks for all the questions, and thank you to your viewers. And Jean is wishing a happy Thanksgiving. I'm not sure if there are any questions, but I too I wish everybody a happy Thanksgiving. Despite these numbers, we have a lot of things to be thankful for. I'm thankful that we have an amazing team here. I'm thankful for the relationship that we have with media who are helping us get information out there. And I'm thankful to all of our community residents and advocates who are out there really doing everything we can to make sure that people have the best information to make the best decisions for themselves and their families.
All right. Well, hearing no further questions, with that, we will call it a wrap. Thank you all very much. We are very grateful for you. And thank you, Dr. Morrow. I will get this video out as soon as it's converted.